when we talk about how to manage the baby, and this is very important. The first and the most important thing is you got to give breastfeeds as much as possible. And by breastfeeds, we mean that you should be sitting on a chair, not on the bed, either on a chair or on a sofa. ভালো করে বসবি, সোজা পিঠ, so পিছনে একটা বালিশ রাখবে, হাতের তলে একটা বালিশ রাখবে. Sit with the cushion at the back and a pillow here. Support your head. Remember, you got to sit for long periods. So you don't want to sort of stress your spine. So you sit on a chair, sit properly, hold the baby properly, and try to breastfeed. And when you are feeding, feed from both the breasts. 15 minute এক একটা ব্রেস্টে, and give it 15 থেকে 20 মিনিট এক একটা ব্রেস্টে. And you must make sure, and this is the most important thing, that the baby is awake. বাচ্চা যেন জেগে থাকে. What most people don't realize is the baby falls asleep. 2 মিনিট টানলো, ঘুমিয়ে পড়লো. So you got to wake the baby up. So 2 minutes the baby is back to sleep. Wake the baby up. ढकार उठाओ अच्छी तरह से, जगाओ उसको, हिलाओ उसको, ढकार उठाओ, put the baby back on the breast. उठाओ, जगाओ, हिलाओ, and put the baby back on the breast. This is how you do it. Breastfeeding is something which is, is the best, and there is no comparison. There are many studies to show that if you give breastfeeding, the immunity of a child will be much more. The protection from infections much more. The chances of the baby developing diabetes, hypertension, and other adult onset diseases are far less. So even if you have the gene to have diabetes, if your baby is nurtured with proper nutrition for the first 1,000 days of birth, by 1,000 days I mean the first 9 months of pregnancy and the first 2 years. So this total period, if you provide a right environment, right nutrition to the child, the chances of, even if you have the genes, they are blossoming out and producing catastrophic diseases in adulthood is far. With your lips হয়, এটা যদি nipple হয়, তাহলে put the nipple inside the mouth and rub the nipple on the tongue and the palate. দেখবি বাচ্চা সাক করতে শুরু করলো. জাগাবি, নিপলটা ঢোকাবি, নিপলটাকে রাব করবি, ভেতরে ঢোকাবি, বাইরে বার করবি, দিয়ে বাচ্চা কিছুক্ষণ বাদে দেখবি এই suckটা becomes weak. When the suck becomes weak, take the baby out, jaga thekutala. So that is how you feed. And 15 to 20 minutes এমনি করে, 15 to 20 minutes এমনি করে to give বাহার কা দুধ. Then 1 ounce জল দিলে 1 চামচ পাউডার, 2 ounce জল দিলে 2 চামচ পাউডার. That's the way you do it. Ounce means 30 ml. So you put 1 ounce in a bottle, then you give 1 চামচ. 2 ounces you give 2 চামচ. 3 ounces you give 3 চামচ. How much the baby is going to take, it depends on the baby. Top it up with bahar ka dudh. And in that case, the dilution will be 1 1, 2 2, 3 3, 4 4 এমনি করে. 1 means ounce, 1 চামচ মানে হচ্ছে that ওই চামচ যেটা ডিব্বায় আছে এবং কাটা কাটা করে লেভেল করে. Is everybody clear about this?
Yes.
So breastfeeding, and how frequently are you going to give it? যখন বাচ্চা চাইবে. If the baby wants after 15 minutes, give it after 15 minutes. If the baby wants after 4 hours, give it after 4 hours. So on demand. But you should not go beyond 4 to 5 hours. 4 থেকে 4.5 5 ঘন্টা যদি হয়ে যায়, বাচ্চা ঘুম থেকে উঠছে না, ঘুম থেকে তোলো, দাও. Am I clear about this?
Yes.
So on demand, but should not go beyond 4.5 to 5 hours. Then you can have a normal diet. Take a healthy diet. You know what healthy diet is. I don't have to tell you now at this point of time. So healthy diet, you can take বেশি ঝাল, বেশি মশলা না খাই ভালো. ज़्यादा तेज, ज़्यादा मसाला मत लो. बाकी you can take whatever you guys take normally. বাইরের জিনিস মানে যেখানে ইনফেকশন হওয়ার চান্স আছে সেখান থেকে দূরে থাকা. টেক অ্যাডিকুয়েট অ্যামাউন্ট অফ প্রোটিনস, calories, even fats, a little bit of carbohydrates, and plenty of fruits, vegetables, vitamins. Okay. আর কিছুদিনের জন্য সিগারেট, অ্যালকোহল খাস না. চারাস, গাঁজা, হেরোইন, কোকেন, মারিজুয়ানা, LSD and all that. You try to avoid this. জানি একটু অসুবিধা হবে, but so try to avoid them. Okay. Take plenty of fluids. Okay. With COVID vaccine, you can breastfeed. Okay, so there is no problem. Breastfeeding এর কোনো ইনহিবিশন নেই. ঠিক আছে? That's about it. Daily soap bath. A lot of people are going to talk to you about sponging and all that. No. The baby was inside a bottle of water for the last 9-10 months, so there's no point in giving a bath. So give a proper bath. In England, we used to deliver the babies under the water. So there's no point in giving a sponge. Give a daily soap bath right from now. Shampoo on alternate days right from now. স্নানের আধ ঘন্টা আগে নারকোল তেল বা অলিভ অয়েল দিয়ে massage করবে। नारियल के तेल या ऑलिव ऑयल से मसाज करो। सरसों का तेल मत देना, बिल्कुल मेरा जैसा कंप्लेक्शन, मेरा जैसा बाल होगा। सो डोंट गिव सरसों का तेल, गिव नारियल का तेल मसाज नहाने से आधा घंटा पहले और नहाने के बाद और रात को लोशन से मसाज करो। सो आफ्टर बाथ एंड बेड टाइम गिव प्रॉपर लोशन मसाज। विल मेंशन द लोशन इन द डिस्चार्ज समरी। ओके, নাভিতে একটা ক্লিপ আছে দেখেছিস? ওটা কলেজ লাইফ অবধি থাকবে না, ইট উইল ড্রপ অফ। সো ইট উইল ড্রপ অফ উইদিন দ্য 7-10 days, and all you got to do is to you clean it up with a little bit of alcohol. It's available downstairs, and clean it up with alcohol and apply tea bagged ointment. So apply an ointment there दिन में 2 बार करके for 1 month. It's going to dry up on its own. No tulsi pata karas, no shahad, no jamgutti, no gripe water, no pani. So these are the things which need to be avoided. Okay, and remember, it's winter is coming. That doesn't mean the baby will be wrapped in 15 blankets. The doors will be closed, the windows will be closed, heating will be on. Don't do anything of these sorts. So do not overwrap the baby. You know, if you are feeling cold, the baby is feeling cold. So do not use a heater. Room heater should be avoided because it causes drying of the baby and it causes dehydration. Don't do it. ঘরের জানলা দরজা খুলে দিবি, there must be ventilation in the room. That's very important. God forbid if anybody has COVID, please feed the baby. Make sure that the baby stays with you even if you have COVID. Make sure you keep the baby away from people who are sick. কেউ যদি কাশি সর্দি থাকে তাকে দেখাতে আসবি না। If you think that you need 35 blankets, the baby needs 35 blankets. If you think that the baby needs you need an AC, the baby needs an AC. AC চালাতে হলে AC temperature 25-26 এ রাখবে। বাড়িতে কারোর কুকুর আছে? গুড। যদি না থাকে ভালো, যদি থাকে তাহলে অন্তত সেই ঘরে যাবে না। মানে the dog shouldn't come into the room for the first 2-3 months. Okay. Make sure all vaccines are given. There are lots of even pediatricians who say that এটা দিতে পারো না। No. Whatever vaccines are mentioned in the Indian Academy of Pediatrics chart should be given. Don't avoid any vaccines. And the times are more or less, you know, it's a little flexible. As এরকম নয় যে তোমাকে 16 তারিখে ডেট দিলে 16 তারিখে না দিলে ভ্যাকসিনটা দেওয়া যাবে না, because this is a common thing we hear. So it's a flexible time, but you should, and your next vaccines will be due after 6 weeks of age. 6 weeks of age. We have given all the vaccines at birth. যা দেওয়ার আমরা সব দিয়ে দিয়েছি, and you will get a vaccination card for the baby when you are discharged. I think I've mentioned almost everything. Anything you guys want to know? কোনো প্রশ্ন আছে?